It's a brand new year and the first edition of Weekend File. Thank you for being a great partner in progress as we look forward to a brighter and prosperous year ahead, which we all hope will be in good health, of course. As they say, health is wealth, right? And talking about health, from a stethoscope view, Nigeria in the outgone year set targets and introduced reforms in the health sector, which some experts say are laying the foundation for growth, stability and resilience for the nation. No doubt, healthcare remains top priority for the present administration, especially with ongoing reforms expected to deliver tangible relief to Nigerians from achieving health insurance coverage, with a new target of 44 million citizens by 2030 expected to mark a transformative leap towards ensuring access to affordable and quality health care for all, as part of efforts to reduce out-of-pocket spending. Health financing is another major yardstick that experts are clamoring for that must be leveraged to achieve expected goals in the health sector, from investment in health infrastructure to technology and emergency preparedness. Also critical is the expansion of the primary healthcare, strengthening of immunization, of course, and improving service delivery. So tonight, we x-ray the impact of these reforms and expanded coverage in the health sector, both at the tertiary and primary levels. Our guest is Mr. Sidney Sampson, founder and global managing partner, Sidney Group. So relax and let's begin by unraveling stories making headlines today. In the meantime, welcome on board, I'm Ruth Aguele. A total of 2,294 graduates have been awarded various classes of degrees at the maiden combined convocation ceremony of Kashim Ibrahim University, Maiduguri. Out of the number we had, 26 graduates emerged with first-class honors. The historic ceremony attracted dignitaries from across the country, including Vice President Kashim Shettima. Mohammed Goni reports.
The maiden convocation marks 9 years of academic excellence at Kashim Ibrahim University and celebrates the institution's transformative impact on students, the host community, and national development. The ceremony also featured the investiture of the newly appointed Chancellor of the university and the conferment of Honorary Doctor of Letters degree on the Chancellor, Oba Adeyeye Anitan Ogunwusi, and Pro-Chancellor Muhammad Indimi. The combined convocation covered 3 academic sessions, 2022-2023 with 523 graduates, 2023-2024 producing 489 graduates, and 2024-2025 with 1,282 graduates. Special guest of honor, Vice President Kashim Shettima, who established the university during his time as Governor of Borno State, commended both past and present leadership for the institution's rapid growth and development.
To the graduates, I say, walk up and justify the faith invested in you. To Kashim Ibrahim University, I say, this is the only beginning. And to Borno State, I say, the future you refuse to abandon has arrived.
I heard the Vice President of the Federal Republic of Nigeria has given scholarship to best graduating students. I also want to inform the gathering that I have given approval for the recruitment of all the 81 best graduating students of the 2023-2024 and 2024-5 graduating students as lecturers of this university.
The Chancellor, Oba Adeyeye Ogunwusi Ojaja II, and the Vice Chancellor, Professor Babagana Guti, highlighted key projects executed by the university and urged graduates to serve as worthy ambassadors of the institution. Goodwill messages from sister tertiary institutions added color to the occasion, alongside the presentation of awards and prizes to deserving students in Maiduguri. Mohammed Goni, NTA News.
Federal government rolls out a 50% train fare discount from Aba to Port Harcourt to ease the holiday congestion. And we hear passengers describe the gesture as timely and commendable. Gabriel Amilike will tell us more.
To management of the Nigerian Railway Corporation, the 50% discount described as Christmas bonus took effect from December 23rd and spanning through January 3rd.
This year, the fares have been reduced by 50%. That is, the first-class coach has been charging 1,500. Passengers are paying 750 naira today. The second-class coaches that have been charging 800 naira. Passengers are paying 400 naira. And you can see the crowd here. You can see the excitement.
I'm very happy about that. At least when I was coming, I'd already bring up 800 naira. They say it's 400. I carry my 400, put back, pay the 400.
We usually pay 3.5. Yeah, for bus. By train, before it's 800 naira, but because of the S-Mass discount, it is now 400 naira, and we are really, really, really happy about it.
Others, however, appealed for extension of the price slash beyond the festive season. They also called for the provision of additional coaches to accommodate the increasing number of travelers on the routes.
Imagine now it's only one coach for VIP that is available, and they have plenty passengers. So they should improve, please. I know I appreciate the 50% discount, but they should improve. We can do better.
As Nigerians continue to travel to reunite with loved ones during the holiday, they say sustained investment in affordable and efficient rail transportation will not only ease congestion on the roads, but also strengthen public confidence in the nation's railway system. Gabriel Amunike, NTA News.
In other news, Sokoto's state chapter of APC has commenced e-membership registration exercise, a strategy aimed at reorganizing and updating the party's database. Bashir Ibrahim Nababa reports.
The e-membership registration exercise is to formally document and authenticate party members through a technology-driven process as part of bold move to reposition the party. APC chieftain Senator Aliumaga Takardawamoko described the APC as party for all Nigerians.
The party is committed to take Nigeria to greater height. I believe that once this session is over, it is form part of future planning of the government in terms of services distribution and other matters that relate to good governance.
Sokoto State APC Chairman Isa Sadiq Achida urged all party members and supporters to key into the exercise, assuring that adequate arrangements have been put in place to ensure a smooth and credible registration. The exercise is to be conducted simultaneously across the 23 local government areas of the state, with the support of trained personnel deployed to handle the equipment to ensure effective coverage of all party members. From Sokoto, Bashir Ibrahim Nababa, NTA News.
As the year 2026 dawns, the Cross Rivers State Government is organizing a peace walk to sensitize residents, ex-agitators and repentant cult groups on the importance of sustaining peace and security in the state. Koko Henshaw, the Special Advisor on Forensics and Intelligence to Governor Basi Oto, assures that the administration remains committed to engaging youths through skills acquisition and empowerment programs to take them off the streets. Justina Etienne reports.
The peace walk kicked off at the Millennium Park, where the governor's representative addressed the participants as ex-agitators and ex-cult groups signed a peace accord with the government, pledging to shun social vices and work towards lasting peace and security in the state.
Ever since our executive governor was sworn in, I can assure you that there have not been any cult activities, cult war in the state. As you can see, the state is very peaceful, and I will continue to maintain it.
We use this opportunity to celebrate the relative peace, the security architecture. You can see the people so excited. It's a special day for all of us.
The peace walk, led by the state's Homeland Safety and Security South, traversed major streets, driving home the message to shun crime and embrace peace. In Calabar, Justina Etam, NTA News.
President Bola Tinubu congratulates Abiodun Esiet, Senior Special Assistant to the President on Community Engagement, North Central. On her 40th birthday, Abiodun Esiet, a gender rights activist, community development advocate and politician, has been recognized by the President for her dedication to duty, particularly in engaging communities across North Central region. In a statement signed by Bayo Nanuga, Special Advisor to the President on Information and Strategy, President Tinubu described the 40th birthday as a significant milestone and prayed that it marks a new chapter of greater accomplishment in her life. All right, we'll take a break now. When we come back, we'll be x-raying the health sector, particularly the ongoing reforms and, of course, the expanded coverage. Are you covered? Let's stay tuned. Thank you for staying tuned. Healthcare remains a top priority for the Tinubu administration in 2025 and even till now, as a series of far-reaching reforms deliver tangible relief to Nigerians while laying stronger foundation for a more resilient and inclusive health system in the years ahead. Oluseyi Adiagbo is standing by with an overview of the major healthcare reforms recorded in 2025, highlighting progress in service delivery and the role of key agencies to drive the Compass strategy.
With a clear goal to make healthcare more accessible, affordable and closer to communities.
From the introduction of the measles rubella vaccine into Nigeria's routine immunization schedule to the launch of local production of insecticide-treated nets, the year marked important gains in child health and malaria control, while reducing dependence on imports and creating jobs.
At the center of government action was the primary health care through the Basic Healthcare Provision Fund, BHCPF, established under the National Health Act. The federal government approved an estimated 98.7 billion naira in 2025 to support essential services for Nigerians, especially the poor and vulnerable.
We've seen dramatic increase in utilization of the primary healthcare centers, the BHCPF centers, more than 80-something million. That's fourfold increase compared to where it was, which is utilization, not individuals, which may also be shifting people coming to those facilities. But at least it shows that the primary healthcare system is beginning to function.
On health insurance, coverage expanded significantly with over 20 million Nigerians now enrolled under the National Health Insurance Authority, increasing coverage from 16.7 million to 20.6 million enrollees in the year under review.
We are equally poised to achieve a significant reversal of the direction of medical tourism, with the potential to domestically retain an estimated 850 billion spent abroad annually by Nigerians on medical tourism.
In malaria control, Nigeria took a decisive step towards self-reliance with the local manufacturing of insecticide-treated nets, ensuring steady supply and future export potential.
The use of technology in the intervention has also allowed for more efficient data collection, analysis, and reporting. This has enabled us to track progress better, identify gaps, and make data-driven decisions to further bridge the gap in malaria service delivery.
Nigeria also made strong progress in HIV control, meeting 2 of the global 95-95-95 targets, significantly reducing transmission risks.
Overall, 2025 closed with renewed hope, not just in policy, but in life saved and community strengthening.
In Abuja, Oluseyi Adiagbo, NTN.
So across Kano, Jigawa and Katsina states, renewed investments in primary healthcare and emergency response systems are reshaping health outcomes at the grassroots. From improved maternal and child health services to stronger community participation, these coordinated interventions are driving a steady decline in maternal, child and neonatal mortality. Aisha Uba Ali reports.
People-centered health care revolves around individuals and communities, not just the treatment of diseases. In addressing structural and systematic challenges, the Kano State government has so far upgraded over 200 primary healthcare centers across the state, many of which are now equipped with solar power and reliable water supply.
This is Kawaji Primary Health Care Center, one of the primary health centers in Nasarawa local government area of Kano State. Now, on getting here, we observe that a whole lot of renovation has taken place in this particular primary health care center.
To further consolidate these efforts, the state identified 18 local government areas with high maternal and child mortality rates as beneficiaries of the MAMI initiative. Still on government effort in revitalizing primary health care centers, the Kano State House of Assembly says its proposal in the 2026 budget includes a requirement for each legislator to facilitate the provision of at least one primary health care center in their constituency. These three expectant mothers, though attending different primary health care facilities, share a common experience.
I even trekked to the hospital because of proximity.
Honestly, there is great improvement, especially in the area of drugs and screening.
In Jigawa State, over 100 primary health care centers have been upgraded, with several others currently under construction. Most of the facilities are solar-powered, significantly improving access to quality health care services and stabilizing maternal and child health outcomes.
This administration has already recruited 827 primary health care workers and also additional 1,500 workers on ad hoc basis. That's so all the necessary staff needed for our health facilities to function are put in place.
The Executive Secretary of the Katsina State Primary Health Care, Dr. Shamsuddin Yahya, says close to 300 primary health care centers have been revitalized and equipped with adequate manpower and facilities to ensure effective service delivery. He adds that plans are underway to further improve the centers, with resources already earmarked for this purpose in the 2026 budget.
Once you see those facilities that have been revitalized, you see that they have whatever it takes. It brings a lot of confidence in the people.
With the belief that with sustained investment, community participation, and political commitment, the three states will continue to strengthen primary health care as the foundation for resilient and healthier communities across the Northwest. In Kano, Aisha Uba Ali, NTA News.
All right, let's bring in our guests to look at the impact of these reforms we're talking about. Mr. Sidney Sampson, he's the founder and global managing partner, Sidani Group. Thank you so much for joining us, Mr. Sampson.
Thank you.
And I could say Happy New Year.
Happy New Year to you too. Thanks for having me on the show.
Great. So let's go to the very beginning, from the outgone year, when we heard from President Trump to court foreign aid. He put the nation rather, on pressure, intense pressure, to look within. Governments at all levels, were on their toes to look at ways to enhance health financing and, of course, improve strategies by looking inward. Going by your assessment, how did the country now stay afloat later on?
Great. 2025 was a very interesting year. I would like to say it's a year that started with a lot of promise, and then some of the hopes got dashed, but it showed again the strength of our country and many countries, and how we can truly be resilient as Nigerians. With the dissolution of the USAID, the country stepped up very quickly, and that was evident in the quick action that was taken by the Honorable Coordinating Minister of Health and Social Welfare in engaging with the President and the FEC to raise resources to fill the gaps that were going to become apparent because of the reduction in available funding. So the country reacted quickly and was able to fill financially a number of the gaps that were going to become apparent from what has happened. But beyond that, one thing that has also happened that put us even in a good position to respond appropriately was what happened in the year 2024, where a number of reforms were put in place by the Honorable Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate. And that was with the sector-wide approach to addressing the health system challenges in the country. Okay. And the sector-wide approach was basically trying to get everyone aligned around the same priorities and trying to reduce fragmentation. And in cases like that, those were the kinds of initiatives that really helped the country pull together the little resources it had to address the gaps that continue to plague the country's health system.
And talking about gaps, let's look at the universal health coverage. There is a target of 44 million by 2030. Already 20 million have been captured. For you, going by the target set and the level of, the percentage, we hear more than 70% or about 70% still pay out of pocket. That's something that it's still being dealt with, and we know it's work in progress. But from the private sector perspective, you're in the private sector, and I know it can play a critical role in terms of support.
Yes, the number around 70% plus minus of Nigerians spending out of pocket for health care has been around for a good number of years now. And I know that the government, the current administration, has done a lot of work in trying to change those numbers. There is the Health Insurance Act that came into full effect last year, April, that has moved towards mandatory health insurance coverage and has contributed to the numbers the reporter presented earlier in the show, in terms of saying that there have been increase in health insurance coverage. And we know that, as it's said in Nigeria, in many African countries, that many households are just one major illness away from death and poverty. But with this new reform that happened and started last year, we are seeing significant change, and particular one to be happy about is the focus on even vulnerable groups, where you have the Vulnerable Group Fund. Yes. That's also part of the new plan, and with that we're seeing more people getting enrolled. But beyond that, there's also the Basic Healthcare Provision Fund, which is a wonderful initiative of the federal government that has gained a lot of momentum in the past few years. And as some of us know, there's been a recent launch of the Basic Healthcare Provision Fund 2.0, which even aims to build on the progress of the original BHTPF fund to reach even more households, reach more primary health care centers, and get utilization up, just like the Honorable Minister mentioned on the show earlier.
You know why I asked that question, Mr. Sampson, particularly because of the role of the private sector. We understand that certain services are not covered under the insurance scheme, and those that are covered in some private hospitals, according to reports, you don't get to receive such services because of lack of cooperation. They're not ready to key into it. That's why I'm asking the role the private sector can play to support the federal government.
Excellent. So coming back to that, interestingly, I met with I was at a hospital yesterday, and this particular situation came up around health insurance, the NHIS or NHI, the National Health Insurance Scheme, and how it's been functioning. First, from the private sector angle, one thing my organization, Sidani Group, has done is, of course, ensure that every single member of staff is fully covered, which again contributes to the pool of covered Nigerians with health insurance. And we make sure we cover them with the right and high quality insurance coverage to ensure that they can access the right care for themselves and their families. But one challenge that has always been there for the private sector, and I think when you mentioned the private sector is not cooperative, I'm not sure that's exactly the way it is, because most private sector organizations that are serious about what they are trying to do and care about their people, they ensure they are covered, so long as the right incentives are there. And for us, a global organization like Sidani Group, we make sure that is the case. There are different components. The NHIS is there, and the work that the private sector organizations have to do. And when you talk about private sector, it's also a very broad range. There are the micro enterprises to the SMEs, and all at different stages. And the question always is, what's the incentive for that organization that has just 2 or 3 personnel, or 5 or 10, or that's making a turnover of a few hundreds of thousands in a year? What's the incentive for them to really cover the people working there? And how is the government supporting them to do that? And we know that in Nigeria, a lot of the enterprises are within that category. So for every entrepreneur, the question always is, how do I balance revenue and expenses, and how do I make sure I even survive in Nigeria's context? So,
especially when it's a business.
Exactly. And so there's always that balancing act of how do we do this? So the question also is, how is the government supporting the private sector to better provide cover for their staff? And we know that the National Health Insurance Authority has put out a number of interesting initiatives to ensure that private sector organizations, regardless of their level, can find some place within their reforms to ensure that their personnel are covered.
At the end, it's just all about affordability, right?
Yep.
So, Mr. Sampson, we'll take a break. Thank you for staying tuned. Before we continue the conversation, we hear as state governments intensify efforts to strengthen, the federal government to strengthen the health sector. In Rivers State, we hear the recording notable investment in infrastructure, manpower and technology. Joy Uzo will tell us more.
Sector reforms in Rivers State were notable in 2025, with investments focused on infrastructure, manpower, and emergency preparedness. The government is expanding access to quality healthcare across the state, with projects such as the recently inaugurated remodeled ultra-modern Ahoda Zonal Hospital strengthening service delivery at the secondary level.
The thinking behind zonal hospitals such as this in Ahoda is that we strengthen the referral system. We strengthen the middle level of care, the secondary level of care within communities.
At the University of Port Harcourt Teaching Hospital, investments under the Renewed Hope agenda are improving access to specialized healthcare services. Stakeholders, however, call for improved funding, better welfare for health professionals, and the adoption of digital and artificial intelligence-driven solutions.
Even though the teaching hospital is a federal government project, as we say, but we worked hand in hand with the states to make sure that the President's Renewed Hope agenda for the health sector is achieved.
AI has made things easy. You can use AI to diagnose some of these sicknesses. When you do that, it will save time and it will remove some of these bottlenecks in terms of diagnosing sicknesses in the health sector. So government needs to do more.
Meanwhile, the recruitment of over 2,000 health workers has helped to ease the doctor-patient ratio in the state, while inauguration of the general hospitals in Bori and Kana alongside electronic medical record systems have improved service delivery and maternal health outcomes, although emergency preparedness needs to be strengthened as insurance utilization in the state remains below 10%.
For 3 consecutive years, we've become the champions in primary health care in the entire country, which is good. We need to get to the level in the state where any emergencies at any part of the state can have direct access to the health facility in less than 15 minutes.
Stakeholders agree that sustained investment and effective utilization of health facilities are critical to building a resilient healthcare system for Rivers State in 2026. In Port Harcourt, Joy Uzo, NTA News.
And health insurance at a national level has been identified as a great policy aimed at providing quality healthcare. And this report takes a look at the initiative and its financial protection.
Recognizing that a healthy population is essential to the economic growth of the country, the federal government introduced a universal health coverage scheme designed to ensure all Nigerians have access to quality and affordable health care services. For medical experts, the implementation of National Health Insurance Authority Act and other strategies by stakeholders resulted in a significant increase in the number of people captured in the year 2025 and a marked reduction in out-of-pocket health expenditures.
The expansion of the health insurance in Nigeria in 2025 was quite significant. At the beginning of the year, we were roving around 5-6 million. As at the end of the year, we had crossed 20 million citizens that have subscribed to health insurance.
Experts also advocate broader healthcare coverage by providers across Nigeria.
The patients with insurance are more likely to complete rehabilitation, recover faster, and return to work because cost is no longer the main barrier. So yes, while expansion is ongoing and gaps remain, health insurance in 2025 has begun to protect households financially and medically.
The need for periodic meetings between players in the health insurance policy, experts maintain, is crucial for resolving conflicting issues.
It's also about having a premium on health insurance that benefits both the provider and the person that is accessing care. And I think that is an area that there's been a lot of engagement with the various agencies like the National Health Insurance Agency and, of course, state agencies like LASHMA.
Health insurance, according to practitioners, is not just a health policy, but also an economic stabilizer, which assists families to perform optimally and remain focused.
All right, Mr. Sampson, I'd like us to pick up with the primary health care. We saw the revitalization, 2,000, more than 2,000 thereabout. But at the state level, we saw what Rivers State is doing. And Kaduna State is another example. We're hearing reports of the state government remotely in equipping 255 ward-based primary health centers. Now, that is quite commendable. But how can the subnationals, support the federal government to make it more expanded, so to say?
Thank you. The question around primary health care centers and their functionality is a very interesting one, because we know that PHCs are the first point of call for majority of Nigerians living in the rural areas and even in urban centers. The disconnect most times when we talk about primary health care is we talk about revitalization, and a lot of times it goes quickly to renovation, and you have these fancy looking renovated buildings, but the services, workforce, yes, commodities, drugs, people, are they there to provide this? And the federal government cannot do all of that. The federal government can do part of it and part of its job, which is helping with revitalizing some of those primary healthcare centers. But we know that the PHC work has the states having to contribute, even the local government areas having to contribute. So the health workforce a lot of times has to come from the states. So how much is the state doing in employing the right quantity and quality of health workers to be in those revitalized primary health care centers to really provide the quality that is needed in terms of care? What about the commodities? The federal government at best can give seed funding and do a few things, but again, the state has to take full ownership of providing those commodities through the drug revolving funds and having their DMAs functioning appropriately to ensure availability of the right essential commodities for care. So a lot of times when we talk about primary health care centers and their functionality, we have to understand the multi-layered elements that are involved in making sure that a PHC is actually functioning, but not just functioning, but delivering high quality care to the citizens that want to access care in those locations.
And the workforce we're even talking about, we hear a ratio of 3.9% to 10,000 per person. That is an issue that was really debated on in 2025, especially with seeing our doctors leave the country. What should be put into consideration going forward to ensure that we have these doctors, stay?
Excellent. Interestingly, Sidani has been doing a lot of work in human resources for health, and we've done a number of in-depth analytics to understand really the drivers, and we've proposed different very interesting strategies, which I won't go in details here. But one thing that has come out clearly in the need for our people in terms of doctors and health professionals is motivation and pay. Because of the global nature of work these days, a lot of our medical practitioners are exposed and have seen the different levels of remuneration across the world. And given the openness to, as we call it, Japa and all, people are able to move around and seek greener pastures. But one thing that's been clear is the fact that if you have people closer to the communities engaged, and you actually get the communities to also own the functionality of these facilities and also the people there, then you have higher chances of the medical practitioners. And for PHCs, while doctors are advised to be across every PHC because of the limited numbers we have, there are now other models that are also coming up in terms of health workers that can also provide care. And on top of that, we also have digital health coming in very handy, where you're having telemedicine also coming in to fill some of the gaps where an experienced medical doctor or practitioner can, from a distance, support multiple primary health care centers to provide good quality care within their locations. But ownership and accountability and better remuneration is key if we have to turn the tide around in terms of availability of the right manpower within the primary healthcare centers in our communities.
And one critical aspect that the tide turned around, we saw immunization expansion. We even saw the introduction, rubella, measles, vaccine was introduced again, and also the malaria vaccine. But that requires a lot of investment, particularly from the private sector. Maybe because, Mr. Sampson, you're from the private sector, and I'm trying to get your insight on what you think can be done to support these initiatives, because we saw the strides recorded, even though there are gaps in the aspect of awareness, access to these vaccines in hard-to-reach areas and all of that, but there could be more that can be done, right?
Absolutely. Okay. And we know that, yes, the measles rubella vaccine was introduced, and it's one of the largest such vaccine introductions globally. And the Nigerian government did a great job of reaching a very high percentage of the target population across the country. But one thing that's clear with such introductions is not just the initial campaign, as it's called, and the introduction. It's the sustainability of the levels that we've reached. Yeah. And that is where private players like ourselves, come in to support as implementing partners, to support the government, not just at the federal level, but also at the states, to really drive the implementation, to sustain the momentum that the country has gained with that introduction. And like you mentioned, even for the malaria vaccine, that's been introduced almost 2 years now across in a number of states. And I know there are plans to expand the states that are receiving the malaria vaccine. Now, that's a very expensive vaccine. Yeah. And it's one that requires a lot of efforts to ensure that every single dose gets to the children that need them. And given that you have to reach those children more than once, that no child is lost to follow up, that each child gets the full 4 doses of the malaria vaccine. And again, a lot of efforts need to come in there. The federal government already provides the vaccines, pays for those vaccines. I wouldn't say they provide them for free because they pay for them. But the state governments now have to also play an active role in ensuring that the health workers are there, the demand and awareness are created, and people know that these vaccines are there and are able to take them, and also works with the right gatekeepers within the communities to dispel any negative information on the sometimes negative impact people would say of these vaccines, which in most cases are just, as they call it, adverse effects following immunization. So the states have their role to play. The federal has its role to play, and I think it's doing a great job with that, but there's still a lot more to do. And like I said earlier, it's been able to maintain the momentum and not backslide, because a lot has already been done, and a lot is still being done to ensure that Nigerian children are protected and the PHCs are functional.
And one strategy to get more expansion is investment in local manufacturing of this vaccine, enhancing or rather strengthening capacity for the country. I see the ministry go into partnerships with the private sector, even the international community. How can this be sustained going forward?
The conversation around the local manufacturing of vaccines and other health commodities is a very, again, interesting or rather complicated conversation. It's one that has been on for many years, and I'm glad to see that the current administration is taking this very seriously and is taking very concrete steps to move from where we were to a place where we actually see local vaccine manufacturing become a reality. It requires a lot of investment, and one thing that we have seen is beyond just the appetite to have it, a lot of factors have to come together. You have to have the right manpower. It requires very high skilled personnel. It requires a lot of stability in terms of also power. It requires assurances in terms of market to consume.
The market will always be there based on demand.
Yes, the market would always be there, but the market is also a global market, because at the end, while you are trying to produce that, there are also global forces that produce these vaccines, and if they produce them at much cheaper rates than you are able to produce, then it makes it counterintuitive, because then you'll be spending more. But the fact is, there is hope. There is hope that if we're able to crack this, we have the West African market, we have the African market, and a lot of countries are also having conversations on how to move this conversation forward, working with organizations like WHO and Gavi and all.
All right.
But yeah.
Mr. Sidney Sampson, would like to leave the conversation there, but I like the word you picked, hope. Let's keep hope alive. It's the renewed hope era, right? So thank you so much for coming on Weekend File. We do appreciate. He is the founder and global managing partner, Sidani Group. Thank you. Thank you for staying tuned, and you're just right in time for sports update. Ayo has all the gist going on for AFCON. Ayo.
Thanks so much, Ruth. Let's begin with the Super Eagles, because that's what matters the most for us here. Now, ahead of their match against the Mambas of Mozambique, the Super Eagles have stepped up tactical preparations with a high level of optimism in this year's tournament in Morocco. Nigeria topped Group C after wins over Tanzania, Tunisia, and scoring 8 goals and conceding 4 in the process. Nigeria versus Mozambique match is live on the NTA on Monday at 8 p.m. All right, elsewhere, the Teranga Lions of Senegal have secured a place in the quarterfinal of the Africa Cup of Nations in Morocco after defeating Sudan 3-1 in the opening round of 16 encounter. Now, Sudan sprang a surprise by taking the lead in the 6th minute through Amir Abdallah Younis, but Senegal responded strongly with a brace from Pape Gueye in the 29th minute and the 3rd minute of first half at a time, as Ibrahim Mbaye completed victory in the 77th minute. Meanwhile, Mali and Tunisia are now rounding off the second match of the day in the round of 16. Woyo Koulibaly got a red card in the 26th minute, and guess what? Just some seconds ago, Tunisia have been able to break the deadlock, and they're currently leading by 1-0 with time added on, possibly expected to change the direction of the match, or Tunisia will go into the round of, that's the quarterfinal, or there will be some extra time. So we can still continue to watch that on the NTA Sports channel with just few minutes added time to change the course of the match, or it ends that way for the Carthage Eagles of Tunisia. Now let's leave the Africa Cup of Nations and cross over to the world of the English Premier League, where Wolverhampton Wanderers recorded their first Premier League victory of the season with an emphatic 3-0 win over West Ham United. Although they remain rooted in the relegation zone, and of course they suffered Burnley suffered a 2-0 away defeat to Brighton, while Arsenal endured a nervy end to their 3-2 victory over Bournemouth, as the Gunners extend their lead at the top of the table to 6 points, keeping their title push alive this season. On Sunday, Leeds United will host Manchester United. Liverpool are at the Craven Cottage against Fulham. Tottenham take on Sunderland, and the weekend action concludes with a marquee Super Sunday clash between Manchester City and Chelsea. All right, so many matches to look up to this weekend, and of course on Monday. That's your sports. It's back to Ruth.
Many thanks, Ayo, and I know why you're excited. You're looking out for Man U.
Obviously on Sunday.
Okay, no comment. But let's do weather together. We'll be back.
Hello, and glad you could join us. Slight dust haze is anticipated over parts of Katsina, Kano, Bauchi, Gombe, Yobe, Jigawa, and Borno State. The north-central region will experience a interval of cloudiness, while southern parts of the country are expected to see increasing cloud cover as the day advances. Meanwhile, there are prospects of isolated thunderstorms in parts of Ogun, Osun, Edo, Lagos, Delta, Bayelsa, and Rivers State. Residents in affected areas are advised to remain alert to changing weather conditions. I am Akami Samada. See you soon for more updates.
There you have it, but we're not done. We have to tell you tomorrow, January 4th, is World Braille Day. It is a day observed by the United Nations to highlight the significance of Braille as a vital communication tool for the blind, promoting their independence, equal access to information, education and public services. The day calls attention to ongoing challenges faced by visually impaired individuals, including limited access to Braille materials in schools, workplaces and during voting in an election. So as the world marks Braille's Day tomorrow, reflect on this and let's give them a sense of belonging, where equity and justice thrive. Don't you think so? And that's Weekend File. I'm Ruth Aguilera. Do have a good night.